discuss one table from Sabiston, that is recommended for timing of discontinuation of anticoagulant for elective surgery. Very important table. So let's see. So what are the drugs and the timing? So warfarin and clopidogrel, the timing of discontinuation is 5 days. So this table is bit varies from the Bailey table, but I would recommend remember this table. Okay, so warfarin and clopidogrel. So W looks like 3 and C, clopidogrel C 3. Okay, so both for both timing of discontinuation will be 5 days. Okay, so next will be direct thrombin inhibitors like dabigatran. Okay, so in normal person, when creatinine clearance is more than 50 ml per minute, so it will be 2 days. Okay, dabi is for 2 दिन. Okay, okay, 2 days. Okay, so let's see if the creatinine clearance is less. So if creatinine clearance is less than 50 ml per minute, so it will be you have to stop within 3 to 5 days. Okay, so further if the more than 50 creatinine clearance and bleeding risk is low, so you can stop just 2 to 4 hours. Okay, so remember this is 2 to 4 hours, not days. Okay, and bleeding risk is low. Okay, if the bleeding risk is high, in high everything is in days. Okay, so 2 to 3 days. Okay, if the creatinine clearance is 30 to 50, so a bleeding risk is low, 2 days, and if the bleeding risk is high, 2 to 3 days. Okay, so in bleeding high risk patient of the bleeding till 30 creatinine clearance, you have to stop for 2 to 3 days. Okay, so in 30 you can remember 33 days till 33 days. Okay, if the creatinine clearance is less than 30, you can, in low risk bleeding patient, you have to stop for 2 to 4 days. Okay, and high in more than 5 days. Okay, now the factor 10A inhibitors. Okay, so factor 10A inhibitors like rivaroxaban and epiaxiban. So in PG days we used to remember like example XA, so name will contain XA. Okay, so factor 10A inhibitors like rivaroxaban, you have to stop for more than 24 hours. Okay, and if it is rocket atrial fibrillation, you have to stop for more than 3 days. Okay, 1, 2 and 3 days. Okay, then epsiexaban. Okay, so in low risk bleeding patient, you have to stop for more than 1 days. If the high risk bleeding patient, it is for 2 days. Okay, now it's antiplatelet agent like aspirin. So you have to calculate the surgical risk and the patient associated risk. If the high cardiovascular risk patient and your surgery is minor, you can continue. Okay, you cannot stop the aspirin. Okay, and if your surgery is high risk and patient is very low cardiovascular risk, so you have to stop the 7 to 10 days. Just remember A is for aspirin, so 1 week, and 10 also 1, so 10 days. Okay, and clopidogrel also I told it's 5 days. Okay, now come to the bare metal stent. Okay, this is very confusing. I will tell you in very easy way. So bare metal stent, so B, I have taken B and M. So B for second letter 2 and M looks like 3. So we'll multiply 3 into 6. So 6, and this is W. Okay, so week. Okay, bare metal stent, delay surgery for 6 weeks. Now come to drug eluting stent. Okay, so I have taken D. D is 4 and eluting is looks like 3. So 4 into 3, 12. Okay, and this is month. Okay, just remember this is drug eluting stent. So 6 to 12 months due to risk of occlusion. Okay, so this you have to remember. Okay, thank you.